welcome to Epic Exchange, the podcast where we have real conversations about senior life, senior living, dementia care, and all the amazing people who make it happen. My name is Erica Lab. I am Director of Team Member Engagement and Culture at Epic Senior Living, the premier senior living provider in the Northeast.
And I'm Sarah Turcotte, Area Community Liaison for several of our Bridges by Epic and Waterstone communities. Together, we'll be your host in bringing you stories, insight, and expert voices from across our organization and beyond. Whether you're a caregiver, a family member, a professional, or somebody navigating the early stages of dementia, or somebody considering assisted living, this podcast probably has something for you. We're here to share what we've learned, spotlight the work happening every day in senior care, and offer ideas and inspiration to support well-being at every stage of aging.
And each episode will be joined by guests who are making a difference, from community leaders to care team members and clinical experts. Today, we are so excited to welcome Dr. Shaun Patel, who's going to discuss proactive brain health and digital innovation in aging. Before we do that, a little bit about Dr. Patel. He is a neuroscientist, entrepreneur, and co-founder and CEO of Neuro, a digital health company leveraging virtual reality and machine learning to reimagine the way we assess and treat brain health, all from the comfort of your own home. He is also the founding general partner of DRADS Capital, a venture capital fund focused on disruptive technologies in healthcare, energy, and technology. Prior to this, he was a faculty member at Harvard Medical School and Mass General Hospital, where he pioneered some of the earliest studies reading and writing the neural code in awake and behaving human subjects undergoing deep brain stimulation surgery. Dr. Patel has graduate degrees in medical sciences, neuroscience, and machine learning from Boston University's School of Medicine and Harvard Medical School. In his spare time, if you can believe he has any spare time, he's a pilot and avid aviation enthusiast, cruising around New England at 5,000 feet. Anyway, we thank you, Dr. Patel, for being here. We're so honored to have you on the show. Can you start by sharing, for all of our viewers and listeners, why proactive brain health matters?
Yeah, I'd be happy to. So this was actually not obvious to us. We had this realization years ago when my colleagues and I at MGH were having a conversation, and we stumbled upon this peculiarity, which now in retrospect seems so obvious. The example we came across is when you go to your annual wellness visit, you go and see your doctor, you get all these numbers and measurements taken, your weight, your blood pressure, cholesterol, blood biomarkers, and you leave that visit feeling healthy or not. But if you kind of take a step back for a moment and think about it, all of those numbers are really pointing to your heart health. And in fact, there's very little, if anything, we do for our brain health. As one of our co-founders likes to say, there's no checkup from the neck up.
I like that.
And that was the real kind of realization, is because scientists and physicians and most everybody today know deeply how those numbers influence our heart health. I go all around the world and I always ask this to the audiences I speak to, which is a simple question: is high blood pressure good or bad? And I've yet to find an audience where that is not an ingrained part of their world knowledge. Mm-hmm. It's like we all know this. We all are empowered by this knowledge. We know that if we have high blood pressure or we're overweight, what to do about it. And we know the importance of it, how it can dramatically influence our longevity and specifically our heart health. But what's really fascinating is that we actually know the same things are true for our brain. Meaning, as humans, we've done these studies, tens of thousands of people longitudinally, for years and years and years, examining the roles of all of these important factors and how they influence our brain health. So it's not like we don't know. It's just we don't address it. And we really thought about why that might be the case, and it all boiled down to that visit. So we get all these numbers, but we ignore our brain. And so we set out to kind of build something that was as simple as the blood pressure cuff, which is this marvelous innovation. No battery required, gives you these numbers, but enabled all of this downstream value around our heart health. We knew that we needed something similar to that, but focused on our brain.
Right. So to lead you into sort of the next top, like sort of moving forward with this, the argument, I guess, would be that the brain health, that information that we're not getting at those appointments is just as important as the physical numbers that we're getting. So can you talk a little bit about like what that, why the attention is necessary and maybe what that would look like?
Yeah, it's a really great question. And, it really kind of taps on the core of the problem, which is the heart is this very important organ, but it really does one thing. It pushes blood through our body. And so from a kind of an engineering mindset, if you will, the scope of the problem is very narrow. You can create all sorts of different ways to measure how well blood is moving through your body. Blood pressure and cholesterol and Apple Watches and all these different things are kind of all tapping on that same problem in slightly different ways. So very easy for us to kind of understand that. On the converse, the brain, on the other hand, is also kind of just one organ, but it does hundreds, if not thousands, of different things. Things like what we think of as memory or attention or our ability to process senses. And each one of them are very complicated and nuanced on their own. And so as a result, I always like to give this examples. Like if you have a heart problem, you'd go to a cardiologist. But if you have a brain problem, well, there's like half a dozen to a dozen different people you might go see depending on the specific thing. Because each one of those areas of our brain is so complicated that we have entire careers built on them. And so as a result, we basically are subjected to these like very poor qualitative assessments that typically look like an interview or maybe a paper-based assessment where you get a score. Or hard to access because it requires an elite specialist for whom there are too few, or it takes 9+ months to get an appointment, and that kind of creates the core friction for even beginning to think about measuring our brain. That's really what we're intending to solve.
Right. So interesting. And before we continue, so our show is focused very much on seniors and senior living. When is it for all of our viewers? Like, when do we start looking for or thinking about brain health day to day? Like, you're much younger than I am, but is this something we should be looking at? Markers, like at what age? I know it's like if you're over a certain age, we know you want to start. But is it ever too early to start looking at brain health?
When do we want to pay attention, Dr. Patel?
Yeah, good question.
Yeah. I think this is the other kind of challenge that we have. It's like today we basically ignore it, or we relegated our mind to something we'll do later in life. But the reality of it is that it matters all throughout life. And it manifests in different ways, typically. A young child might be experiencing different types of brain-related concerns, maybe with attention deficit disorder, or strabismus or lazy eye, or they're playing sports and they want to prevent injuries like concussions. And in the middle part of your life, it manifests in slightly different ways. Maybe you're juggling a career and a young family, so you're not sleeping well. Back pain laughably starts on the dot when you turn 30 and 40. And then as we get older, we challenge ourselves with different types of experiences, right? So we are worried about how we're aging, we're worried about our cognitive abilities, things like our memory and attention. Maybe we're addressing more serious concerns like neurodegenerative disease, Alzheimer's and Parkinson's. Maybe it runs in our family, so we want to be very proactive. And so really, this is something that is kind of a lifelong endeavor. But the gating function has been till date, like how do we even think about this? How do we address this? How do we empower ourselves to not only learn about ourselves, but then to meaningfully do something that will be goal oriented and kind of put us in the driver's seat?
Yeah, I think of when you said that about young people, avoiding concussions in sports or lazy eye or all these different things, and then middle age, like sleep, lack of sleep, all these things. Often, even in the industry of memory care and senior living, we're waiting for that like bad diagnosis, or we're waiting for a sign. Oh, I forgot my keys. Like we always say, like, oh, you're forgetting your keys, or this, or leaving your keys in the refrigerator, or your phone, in the bathroom, or things like that. These signs, but it's like it's way before that. Like we want to start thinking about it way before we see any problems related to the brain health. So I love that, like really thinking about it lifelong and thinking about it for our family members lifelong.
100%. And, you're talking, Dr. Patel, just about tools, and I'm really excited to dive into React Neuro, an exciting project that you've been working on that is going to become and is currently a tool for proactive brain health. And for someone who's never really heard of React Neuro, can you describe what it does and how it works? Because this is really exciting stuff.
Yeah, I would be happy to. And yeah, I wouldn't hold it against you if you haven't heard of it, because no one has really. Our world is completely changing to think about our brain health, and we're kind of in the position to kind of create what we believe will be the kinds of tools and services that we all deserve. So as I mentioned, this started from that observation. What I didn't mention was the reason why we got excited about it is because in this moment in history, we are sitting at the first time where a tool like this is even possible. And what I mean by that is that you may have heard about or seen a technology called virtual reality.
Yep.
These are these VR headsets. You might have somebody in your life. Usually they're young kids who, put them on to shoot zombies or play other kind of fun games. But what might not immediately strike you is, though this is a great gaming tool, this is actually the world's best brain health tool. And in fact, none of this would be possible without this underlying technology. And let me help explain why that is. So when we're born, our brain is a blob of these things we call neurons, and they're essentially randomly connected. There's no meaningful structure to it. But when you open your eyes, and if you kind of remember or kind of look back to an experience where you saw a newborn, when newborns are first born, their eyes are mostly closed. They start to open, and they begin to slowly, in the beginning days of life and weeks and months therein, get exposed to what we would call light, photons. And that starts to hit the eyes, and the brain starts to respond to this light. And over the course of a few weeks and months, you start to develop the ability to see faces. So there's these like clear milestones that happen where baby sees mom's face or dad's face and begins to recognize them. That's the brain actually rewiring and starting to make sense of the information it's experiencing. And the same thing happens for light and sound and touch. And then later, as the baby develops, it's the motor system. So, crawling and rolling and walking, and subsequently, it's even more advanced things. And as we kind of go through our life, we continue to develop our brain and develop more and more sophisticated things. And ultimately, that produces what we think of as kind of our brain. Now, the magical thing about virtual reality is when you put this headset on your head, your brain cannot tell the difference between, quote, reality and this kind of virtual version. And if you want to kind of experience that and convince yourself of that, go on YouTube and type in VR fails. And you'll see all these funny videos of, say, a family, mom and dad. Mom puts the headset on for the first time, And they're in their home. Kids are so excited. And though mom knows she's in her home, she knows exactly her home. 2 seconds later, she turns and runs into the wall or falls to the floor, whatever it is, based on what she's seeing in the headset. Her brain is convinced that what she is seeing is real. And what that tells you is that this tool, this VR headset, is an incredibly powerful modulator or actuator of your circuits, those circuits that form from birth to through life as you develop. And as a result, becomes this incredibly powerful and also, might I add, fun way of measuring how well all of these circuits are working. Now, the key to unlocking that power is designing the experience. Shooting zombies, unfortunately, won't give us a lot of information about, our memory and attention. But you can imagine now if we build games that are really designed from a first principles perspective about how these circuits underlying, vision and audition and memory and attention and reaction time, etc., you can get now very precise, high quality measurements that are also super fun to engage with.
Wow, that's
It's
so cool.
really so incredible. And, this technology is just so advanced, so incredible. Can you just touch a little bit on how this type of testing is different than what someone is getting currently when they're going to their doctor's office for cognitive testing? Can you talk about the differences in what you're seeing with this kind of testing?
Yeah, absolutely. So, I kind of learned this all in real time as we were building this. So we had this observation and then we thought, oh, this is something we know how to build, but we didn't really appreciate what the kind of standard of care is in the world today. And I was really just surprised to learn what it was. So if you show up, and really it doesn't matter, the age, what age range you're in, but if you're like, we're here in Boston, we have the world's best hospitals. If I go to my doctor and say, I'm having a memory issue or an attention issue, the doctor that I interface with, my general doctor, isn't the person to kind of measure those things. I'd have to then meet a specialist. And those specialists are very limited, unfortunately. I mean, you're talking like 8+ months to go and visit one here in Boston, and in many other cities that doesn't vary. The real kind of surprising thing is when you go and visit that specialist, the experience looks like this. It is a multi-hour experience where you sit and you do a series of these paper-based assessments. You can think of them like a worksheet that you might see a young kid doing. You see a picture of a rhinoceros and you're asked to name it, or some number game, all sorts of various kind of exercises, and those are all then scored, and you kind of get scores on across a range of these assessments, and that's the kind of input to the clinician and helping them figure out what might be going on. One of the things that's the least appreciated in this is what is called the white coat effect, which is if you go and somebody says, hey, I'm going to like assess how well your brain is working and they're wearing a white coat, like your anxiety and blood pressure goes through the roof.
Yeah.
And that is, therein influences your ability to perform these things. So these were all like really critical elements that we did not really appreciate when we started building React, but started to uncover as we started using it with our users. Now with React, the experience is fundamentally different. We knew from that, the very first most important thing here is that this has to be fun. Mm-hmm. Nobody wants to go to the doctor for anything. It is a dreadful experience. And humans now, we've made nearly everything in our life fun and easy and accessible, with the exception of healthcare. Mm-hmm. So we knew, okay, we have an opportunity. We have this fantastic platform, this VR headset, which is by design made to be super fun and engaging. We need to lean into that and make these experiences fun. They also need to be short, because you're not going to want to spend hours and hours and hours doing, exercises. We'd rather have them be very short and enable you to do them with much more frequency, which is also really important for, just tracking and measuring your health. And they need to be accessible, meaning you shouldn't have to be sitting in Boston or a major city near a major healthcare provider to be able to get this. You should be in the middle of Vermont, comfortably in your home, being able to do these things. And that's kind of the direction that we've gone in.
It's really just so incredible. And I also would love for you just to share with the audience, we understand that React Neuro's roots include working with professional athletes, such as the New England Patriots. Can you share with us or tell us how that partnership came about and how it helped shape the vision for what React has become?
Yes, absolutely. So a couple of my colleagues and co-founders, Rudy Tanzi and Brian Nayhead, they're both remarkable and amazing scientists at MGH as well, and unusually also involved in the sports world. So Rudy, for a long time, was the brain health advisor to the New England Patriots, and Brian serves as an unaffiliated neurotrauma consultant to the NFL. So he's the doc at all the Patriots matches, the games where if somebody gets injured, he's doing the tests. So one day we were having a conversation with Coach Belichick, who used to be the head coach of the New England Patriots, and he had expressed a frustration of his. If you know anything about him, he's a very memorable character.
To say the least.
And he has a very powerful way of communicating his frustrations, as you might imagine. And he was really frustrated with how players were assessed for concussions, because he deeply cared about the health of his players. That was like one of his topmost priorities. And to him, he kind of nailed it. He's like, when something so important happens, some doc comes and does this kind of follow my finger test. He made a funny joke. He's a religious person, so it looked like he was giving him his last rites, like getting out there. And we kind of heard that and were just taken aback, and then instantly understood the importance of what he was describing, and realized the flaws with all the things that we do today, as we were discussing before, these subjective assessments, and knew that we could do just like we have done for other areas, make the neurological assessment of what we would call ocular motor function, so head and balance, much more quantitative, much faster, and much more reliable. And that kind of was a opportunity for us to realize actually the brain is the brain is the brain. It's like we all have one. We use it in different ways, whether we're getting older in life and want to manage our health and increase our longevity, whether we're athletes or high performance individuals or trying to eke out every little bit of ability, whether we're young kids and parents and warfighters and centenarians. We work across the range, and that's kind of a core component of how we've built React. Is it should serve everybody.
So that's so cool. I'm wondering if you could lay out for us what a session for, just someone at home who is really interested in this amazing technology. What does that look like for them? Like logistically, physically, sitting in their home, participating with React Neuro. What does that look like for one of us who want to get involved with that?
Yeah, I think the best analogy here is to use the heart again. So say you're an individual and you now are motivated to become fit for one reason or another, but you might not be familiar with all the complexities and information in that world. So you might not really know about what diets to use. And if you go to a gym, there's like 100 different pieces of equipment. It's like very confusing as a novice what to do and how to do it. So if you're in that situation, you might find a friend or hire a personal trainer. This person is really selected for their ability to kind of motivate you, right? That's their core. but they also have great aptitude in understanding the importance of nutrition and how to create exercise programs based on your goals and your strengths and also your weaknesses. So if you have arthritis, you might not go and do certain types of exercises, but if you had a very creative coach, they'd be able to kind of still utilize all of that resource, the equipment and knowledge to create a program for you. Now, what React is very, very similar, with the exception of we don't need that physical location with all of those pieces of equipment. The beauty of React is like that equipment is just this VR headset. So anywhere that VR headset can be, you have all of the pieces of equipment built into it, so to speak. It's the different programs, the different games that we have built in.
I just want to say for our listeners and viewers who do not know what that is, it's a simple device that you purchase, right? That goes kind of over your head and covers your eyes, correct?
That's right. Yeah. I mean, a very simplistic way, it's imagine like a small TV attached to your head.
Thank you. Sorry, I just wanted to insert that for folks who are not familiar. Sarah and I are very familiar as we have tweens, but not everyone's familiar. Thank you.
Yeah, it's great. Like almost nobody, like virtually nobody, when we work with new people have ever used a VR headset. So that's really, really important. It's also very important to note that these are, super fun and very easy to use.
Yeah,
So,
really fun.
I mean, my favorite VR game is Dance Saber, just saying.
yes, it's incredible. I mean, it's really marvelous.
It is.
And so, yeah, that's really how it works. Is that we use this portable gym, if you will, in the VR headset as the tools in a tool set. And what we do for our users is we have a brain health coach. This is very much like your personal fitness coach, a person who's just incredibly personable and affable and motivated to help you accomplish your goals, but also to learn about your brain because your brain is complicated. There's so much to know, and not everybody also wants to know everything about their brain. They want to know the level of information that they want to know. And it goes across the spectrum. Some people want to know everything. Some people want to know the least amount. Some people want to know exactly what are the things that they should be doing. And that coach will be able to personalize those experiences and that knowledge for you. And they're kind of empowered in doing that because they have this VR headset that has all of the tools that they would need to use to help you on your journey.
So it would be an assessment and then the tools to meet your needs for where, maybe some of the weaknesses are or, areas of opportunity, we like to call them.
Yeah, I guess, after the assessment, how is that information used, for folks, once the assessment's taken place?
Yeah, so, there is not like this is kind of part of the education process of what this is. Because, to date, we don't do anything for our brains, so we have these relics. We go to the doctor, we get our measurement, and then that measurement means X, Y, or Z, and then I have to do this, that, or the other. I think that's the limited way of thinking about it. I think the new way of thinking about it is imagine now you had the tool that could measure whatever you wanted, anytime you wanted, in just a few minutes in this fun experience. Well, it turns out that many different things influence how our brain performs. For example, when I have young kids, and so when our kids were born, we were using React regularly, of course, and I noticed all of a sudden that my verbal fluency is just a measure of how well I could come up with words, plummeted, just like completely plummeted. I'd be on meetings and just like searching for words. And, I would look back at my data and see, oh, my verbal fluency was here, at some level, and then all of a sudden it went here. And what I realized in that moment was it's because, I was waking up 3 times in the night to feed our kids, and my sleep was getting crumbled. There are, a dozen different things like this that happen to us constantly that we have been conditioned to ignore. And with our seniors, this is like highly, highly likely. We see this constantly in all of our users. And it often has to do with things like sleep and nutrition and what we eat and when we eat it relative to our routines, how we sleep, what's our wind down routine, what our day looks like, are we exercising, what's our mobility. There's hundreds of different factors like this that influence it. But you would never know. We just chalk it up to, oh, I'm getting old and that's just how I'm going to keep going. And I think most people are pretty tough and they're just kind of, go through it without realizing that those things are happening and without realizing that they're very modifiable if you identify it. The reason why that's so important is because of what we would think of generally as resiliency. It's like if your brain, the foundation of your brain is very resilient, then you are in a better position to whatever might come in the future than if your brain wasn't. Even something as simple as a cold can completely change the trajectory of your longevity if you're not in a resilient place. Or, even something worse like a fall. And so it is wildly important to track and measure these things and to just improve and use all of the variety of things our brain can do because, very simply, it keeps your brain resilient. It's that old adage, use it or lose it, that's really critical. It's critical to everything, not just our brain, but it's especially important for our brain.
Yeah, it's like listening to you say that about like it's similar with falls with physical health. The stronger we are physically and we have an unfortunate like physical event, any sort of event, we're going to be more resilient. Same with brain health. So, but we largely overlook that there's anything proactively we can do about it at any age. And so this is really an opportunity for the folks using React Neuro to start improving upon their brain wellness like immediately. And so do you find the folks that are clients of React Neuro that are using this tool in their home, are they making changes? Do you see that they're impacted by the data enough to make lifestyle or, different changes for themselves to improve brain health?
Absolutely, yeah. So, I think one of the big game changers is when you're able to see the data for yourself. To date, like you might get an assessment and you get a measurement and you have to kind of take the word of the person doing it. But when you can actually see, because all of this is so quantifiable, the reporting back to the user really pinpoints exactly the critical elements of their performance as they play these games and how that then relates to the topic at hand, the strength or the weakness. And you just mentioned something very interesting about, say, brain and also motor. Well, React is actually measuring both of those things. The motor ability, the control of your body is an incredibly important part of what our brain is doing. And so like that can be a precisely great example is like if you're playing a game, but it's taking you say, 300 milliseconds longer, something that seems laughably slow and imperceptible, but meaningful from a brain health perspective, can be highlighted. So every time that you're doing this thing, it's taking you this much longer. Or when you're using your working memory, say, you're making more mistakes and your eyes are moving this way. And when you are, shown an image like this, where the balance might be off, your body starts to tilt. And so there's all these different subtleties that we're emitting constantly. Sometimes we perceive them. It's like the where are my keys again or what am I doing? But many of them we never perceive because our brains are just not wired for that. But we're constantly emitting these little tells. And we will miss them, our friends and family and loved ones will miss them, but these quantitative digital systems will capture them with high fidelity over and over again. Now, it doesn't know anything. All it's doing is it's measuring the ability, and it's just going to tell you, hey, it took you this much longer, and your eyes moved this much, and your body moved this much, and whatever the results might show you. But then, when empowered with a coach and with the a user, we can start to now make sense of what those really mean and what we can do about it.
Yeah, it's really incredible. And I really want to be able to just share some brief kind of final thoughts and reflections, Dr. Patel. This has really been great information. But, with everything you're sharing, what gives you the most hope about where this kind of technology is heading? Like, what are you most hopeful about with this program?
Yeah, I am the most excited about this because of the idea of democratization. And what I mean by that is, there's a really great example. It's vision. This is an extremely common example for many people around the world, especially our seniors. Very often we meet people who have gotten accustomed to wearing their glasses, and maybe their prescription is, a few years old. And of course, our vision can deteriorate as we get older, but it's good enough. You can see good enough. But what we don't realize is, like, imagine your lenses are getting blurrier and blurrier. The information to your brain is getting noisier and noisier. It might be fine for you. You can still probably navigate your life and do everything just fine. It's not a huge inconvenience. But now let's think about it from your brain's perspective, and that use it or lose it idea. Your brain is getting noisier and noisier information slowly over time. So the information it's processing is noisier and noisier, which makes the circuits less resilient. It makes them weaker. And then we don't realize anything happens until that one moment that, something unfortunate happens, our foot gets caught on something, or we walk up to an escalator and we have a momentary lapse, and, these small little tiny things that are hard to even imagine, but like it's the needle in the haystack and tips the risk against us. Now, this happens because of a very preventable and easy thing, a vision exam. But it's so inconvenient to go and schedule and do it, so we don't do it. The pain and annoyance of going through that outweighs this really important value. But now let's say, what if you could do a complete vision exam, equivalent, in fact better than what you would get with your optometrist or ophthalmologist in your home in a matter of less than a minute. And you can do it whenever you want, anytime you want. And in fact, imagine now you could do that for not just vision, but for all the things, for hearing and balance. And now imagine you can do that without feeling like you're doing an exam. You're just playing a game, just like you might play your crossword puzzle. And you just do it periodically because it's fun. And now imagine, not only is that measuring you, but it's also improving all of these functions. And now imagine it's adaptive, meaning no matter how well you are at playing the game, it will always adapt to you. And slowly behind the scenes, it will become slightly harder as you do better. Imagine what that would do from an individual's perspective in terms of maintaining and strengthening their brain. And lastly, imagine all of that could be done better than any clinician or any institution anywhere in the world. That's the part that really, I think, excites me, because this concept is completely new. Nobody can imagine any of those things today because it's just impossible to even to think about. But what's really exciting is that it's real.
Well, that is Dr. Shaun Patel blowing our minds with React Neuro. It's really unbelievable. Unbelievable.
Great work, Dr. Patel.
Thank
you and your
you.
team are amazing, and cannot thank you enough for being here to share your expertise in React Neuro and brain health. I think this is valuable information.
Yeah, thank you for the work you're doing. What a pleasure to have you on our podcast. This is Erica and Sarah signing off from Epic Exchange. Thank you, Dr. Patel. We'll see you all soon.